So Duncan and I today are going to talk about what a typical acupressure session looks like and the different steps that we go through as we offer one to one of our animal friends. So the first thing that we would do would be the kind of pre-session preparation, and that would involve centering ourselves, taking some deep breaths, just setting our healing intent, and being ready to offer that good calming energy and healing energy to the animal that we're going to be working with, and also asking permission of them to be able to work with them and to be in their space. And so that would be kind of getting ready for the session. And then once we do that, then we would move into the 4 examinations, and the 4 examinations help us to gather information so that we can identify any patterns of disharmony, any issues that they're dealing with, that would help us then to select acupressure points that we're going to be working with. And so the 4 examinations start with observation. So without touching the animal at all, we would just look at them, see if there's any eye or nose discharge, see if their ears look red or there's any gunk in there. Look at their overall kind of gait, their body condition, their nails, are they more worn on one side than another? Anything that would help us to see anything that's going on with them. So everything that we can just observe on the outside. And then we would move into listening and smelling. And for that, we would listen for respiration. Is there raspy breath? Do they have fast respiration, slow respiration? If there's any smells that would indicate any specific type of pattern of disharmony or issue that might be going on, coming from their mouth, their ears, their skin, anywhere like that. And then we would move into getting the history from the owner. So we would talk to them about any information that they can provide us with previous health issues, any chronic conditions they're dealing with, but also their diet, their activity level, what their emotional constitution appears to be, any preferences that they have as far as hot, cold, drinking a lot of water, not drinking a lot of water, being indoor, outdoor, anything like that. And just gather as much information as we can from their perspective about the animal to, again, help us to add to the other information that we're gathering. And then after we get all of that history information, then we would actually do the physical hands-on palpation of the animal to feel for any hot or cold spots, any areas of reactivity, any areas where there's a difference in muscle tone or some muscle atrophy going on, anything that we can physically notice when touching them that, again, may indicate some sort of imbalance. And we would add that all to the pool of information that we have. Once we finish the 4 examinations, then we're ready to do the opening of our acupressure session, and that consists of running your hand lightly along the bladder meridian 3 times on either side of the dog's body. Now, although the bladder meridian actually starts on the face, since most animals don't really like people touching them on their head and face, especially if they're strangers, we typically start that right at the base of the neck and run that down through the bladder meridian, again 3 times on either side. And then we move into actually feeling the different association points along the bladder meridian on the spine of the animal. And so each of the association points is associated with a zang fu organ. And so by feeling the different association points and noticing if they're hot or cold or mushy or hard, we can see if there might be a specific imbalance in a particular meridian, or potentially a zang fu organ that is out of harmony that we need to focus on during the session. And so for the association points, we start out with bladder 13. I'm going to have you there you go. Bladder 13 is going to be kind of just right over by the scapula here as you drop down. All of the association points are about 1.5 cun off of the dorsal midline. And so bladder 13 is going to be associated with the lung. And then we move down a vertebrae to bladder 14 for pericardium. And then we move down another one, bladder 15 for heart. And then we're going to slide down a little bit, and you can feel a little bit of a flat area on the spine before it starts going up again. And so that is going to take us to bladder 18 for liver. And then we're actually going to skip a vertebrae and then go one more to bladder 19 for the gallbladder. And then we go to bladder 20, which would be for spleen. Bladder 21 is going to be one more down for stomach. And then bladder 22 is going to be one down from that, and that is triple heater. And then bladder 23 is going to be for kidney. And you find that by, again, sliding your hand up. It's going to be directly up from the 13th rib or the floating rib. It's going to take you to bladder 23 for the kidney. And then bladder 25 is going to be about 2/3 of the way between the iliac crest and where bladder 23 is. So that'll take us to bladder 25. And then bladder 27 is going to be kind of right at the iliac crest. And that is for small intestine. Bladder 25 is for large intestine, if I didn't say that. And then the bladder association point is bladder 28, and that's going to be kind of in just a little divot below bladder 27. So you're going to feel all of these and see if any of them have any noticeable issues. If there are any that do, then what you're going to want to do is feel for their alarm points that would be corresponding to them. So if, say, kidney 20 or bladder 23 for the kidney association point felt a little warm or out of balance, then you would feel the alarm point for kidney, which would be gallbladder 25, and you would see how that felt. And so you would know if the alarm point also felt out of sync and a little bit unusual, then there may actually be an ongoing issue that's actually starting to infiltrate in the Zang Fu organs and isn't just superficially affecting the meridians and the qi flow in the meridians. So once you do the association points, you check the alarm points, then you would select the acupressure points that you actually want to work with for your session. And how many points that you select is going to depend on the animal, their age, their condition, what's going on with them. Typically for an older sick animal, you're going to pick maybe 4 points to work with. For a younger animal, you may pick up to 8 points or something like that. You want to just make sure you're not doing too many, because not only can that be hard for the animal to sit with and be in the session for that long, but also you want to make sure that the points that you're working, you're not kind of bringing too much energy to them and too many energy shifts all at once. So you can always work with different points or additional points at the next session if they tolerate that well. But kind of be conservative, especially with the first session that you work with. So when we're picking points, we will select the points that we want to work with. A lot of times you'll pick the yin organ meridians first, since they're deeper in the body, and so we'll start with that. And the 2 different techniques that we use to work with the points, first would be the thumb technique. So for instance, if we were working with, say we're working with bladder 60 here. So bladder 60, we could just use our thumb. It'd be at about a 45-degree angle, and you just lightly put some pressure there, and until you feel a little bit of resistance and then a little bit of a release, and just kind of gently do that, repeatedly for about 1 minute to 2 minutes on each point. And again, you don't want to press too hard. You're just going to gently press down till you feel a little resistance, and just gently work with that point. And watch for any releases or indicators from the pet that they are feeling an energy release, and that energy is flowing more smoothly. And the second technique that you can use for working with points is where you would have your middle finger over your index finger, and you do basically the same thing. So if we're working with liver 3, for example, that would be here, and again, you would just gently put that pressure on, and your other hand is going to be somewhere on the animal as well, just as a grounding force that you have. And so you're going to work with those points and just gently do that for them. Once you've done all of your point work, then you're ready to move into the closing. And so for the closing, what we would do is, again, we would just gently trace the meridians of the points that we worked with. So just gently smooth over those areas and kind of seal up all that healing intention and energy work that we've done, and help facilitate that smooth flow of chi throughout those meridians, and indicate to the animal that we're done with the session, and we're just finishing up, and thank them for their time with us and for allowing us to work with them today. And then we would provide to the pet parent any recommendations that we have, any kind of take-home advice that we have as far as any changes that they might want to make to their diet or activity, or that they maybe want to consider going to see their veterinarian for follow-up if there's an issue that's not resolving, and any point work that we can maybe show them to do at home in between sessions, and then a recommendation for when it would be best to bring their pet back in for another session. And then we are done, and we document everything, and then we're all finished with our session. Thank you.